Hi everyone, we're on our final part of the Vessels in Circulation chapter. Full disclaimer, I was up at 4:30 this morning with my baby boy, and he has now been placated and I put him back to bed, but I'm still up, so hey, I'm ready to rock. Got my cup of coffee, got my bathrobe on, and what better way to spend the early hours of the morning than talking about the vessels in circulation. So let's get after it, shall we? We'll start just by a quick review of the pulmonary and systemic circulations. We talked about this earlier when we were looking at the heart because it's helpful to kind of navigate your way through the heart when you know the different circulations. But just by way of review, the pulmonary circulation goes to the lungs and back by way of the pulmonary artery and pulmonary vein, and then that leaves us with the systemic circulation. This is kind of interesting schematic here showing kind of generally the main regions of the body that are fed blood from the systemic circulation. You've got it going to the upper body, you've got it going to the liver, you've got it going to the intestines, and all the other organs in the abdominal cavity, into the kidneys, and then to the legs. And then all of that blood makes its way back to the heart. Don't be deceived by this diagram, though. They've not really shown us the difference between the superior and the inferior vena cava. All right, we'll take a look at the systemic arteries first. The place that I like to start when we're looking at these is the heart. So if we were to kind of take a snapshot here of the first vessel coming off the heart, it looks something like this. Now, a trick question, and one that people usually don't think about, is if I were to ask you what the first arteries coming off of the aorta are after the semilunar valve, most people are tempted to think it's these ones that are at the top. But in reality, don't forget about the coronary arteries. The first vessels off of the aorta, which is this first big vessel leaving the top of the heart, are the right and left coronary arteries. Okay, and those are the ones that again go to perfuse the heart. Okay, these first three branches here are going to send blood. All of these branches eventually send blood to the arms and the head. You're going to note that there are three branches off of here, which is a little bit confounding. Ultimately, from those three branches, four vessels will emerge, because there's one that goes down to this arm, there's one that goes down to this arm, and there's one that goes to this side of the head, and there's another one that goes to this side of the head. So there's ultimately four pathways of blood, but only three branches, and you'll note here that the reason for that asymmetry is that these two vessels, the one that goes to the right side of the head and the one that goes to the right arm, merge in a vessel which is called the brachiocephalic artery, which literally means arm-head artery. Okay, we'll look first at the vessels that go to the head, which are called the carotid arteries. You'll see that it says common carotid, and that is a word that you'll find sometimes in vessels, which means that the vessel is eventually going to bifurcate, and bifurcate means to split. And if we get a little bit further up away from the heart, this is kind of the story of the common carotid. So this is a picture showing a common carotid right here. So that would be one of these branches right here, or one of these branches right here, either one of these common carotids. And when it gets a little closer to the head, it splits into an external carotid and an internal carotid. The external carotid, if you follow it up, will go up, 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 and then it will send branches to the different parts of the skull, and even into the kind of around the mouth, to the back of the head, all these places. The internal carotid goes up and into the skull through the carotid canal of the skull, and then it goes up into the brain, and it's one of the main arteries to send blood to the brain. Now, what's interesting, a place that I always like to mention here is the carotid sinus, and we talked about this earlier when we were talking about the baroreceptors, but right here, this place called the carotid sinus, the place where the external and the internal carotid emerge from the common carotid, there's actually quite a bit of baroreceptors here. And this is one of the key places that blood pressure is monitored and regulated, because we want there to be a high blood pressure in this region so that it can overcome the pressures of gravity and perfuse the brain. Okay, mostly it's important for the internal carotid perfusing the brain. And if you've ever felt dizzy before, or if you've ever fainted before, it could be the case that it was because you had low blood pressure. Maybe if you stand up really fast and the blood pools into your legs and you have a sudden low blood pressure that makes you feel really dizzy, it's because probably the baroreceptors in here were detecting a low blood pressure and they were sending that signal to the brain. And it's kind of an interesting mechanism. If you do have really low blood pressure, these will basically cause you to faint. They'll send a signal to your brain that kind of shuts off your some of your parts of your body and you faint. And the reason for that is that then no longer is there this big column of gravity to overcome. If you're lying down flat, blood can easily perfuse the brain even if there is a low blood pressure. So kind of an interesting response here. I always like to mention too, there's some of those like kung fu movies where they'll see like somebody judo chop somebody to the neck and then they fall to the ground, and there's actually a little bit of a science to that. If these get hit really hard and it stimulates or it simulates a super high spike in blood pressure, which kind of just shuts things off. So it's kind of an interesting reflex. Okay, so that's the carotid vessels. Again, you have a right and left common carotid artery that both bifurcate into a left and right internal and external carotid. Okay, moving down to talk about the subclavian vessels. So let me just back up here. These are the common carotids, but we still have the subclavian vessels, and these are the ones that send blood to the arms, the right and the left arm. Subclavian literally means below clavicle, and if you look at this vessel, you can see that, it does go right underneath the clavicle, which is this bone here. So it's aptly named. What's kind of difficult about all of this is that the same vessel has different names depending on where in the body it is. So you can see this is all kind of one big vessel right here, but it has different names. And the first name is off the heart is the subclavian. That's the one that's going to take us to just underneath the clavicle. However, once it gets past the superior margin of the first rib, so here we have a rib, and the superior margin would be just the top part of the rib. As soon as that vessel gets past the first part of the rib, past the top of the rib, it's now no longer called the subclavian, and it's called instead the axillary, because it's going toward the axillary region of the body. So another good name here. Okay, it's going to stay the axillary artery until it passes by the inferior margin of the teres major muscle, which is somewhere around here. So it's a little bit hard to know when it becomes the brachial, but it's usually what I say is once it starts coming along the shaft of the humerus. It's a pretty safe bet. Okay. And on a lab practical, I'm not going to put a pin in some ambiguous area. I'll either put it where it's clearly the brachial or clearly the axillary. But in either case, as soon as we're riding along the humerus, now it's called the brachial artery, and that is a good name because this part of the body is called the brachial part of the body. So this is the brachial artery. This is the one where blood pressure will be measured. Usually when they measure blood pressure, they'll put a stethoscope right here, and they'll use a sphygmomanometer. But the brachial artery will come down, and it will bifurcate, meaning split or fork, and then it will have these two branches here, the radial and the ulnar. And the radial and the ulnar are named because of the bones that they go along. So you have the radial artery going across the radius, that's the thumb side. You have the ulnar artery going across the ulna, which is the pinky side. And then together these come into an arch, and then they have digital arteries, which will go to the digits, the fingers. This is the same on the right and the left side for the arteries. Okay, so that's going to take care of what's going on with our arms and also our head. Now we have to talk about what's going on with all this stuff, the trunk and the lower extremities. So we'll take a look here at a nice view of the aorta. You'll note there are actually a whole bunch of branches here that go to different places. and we're not going to worry about those in this class. The first set of arteries that you want to know is once we get past the diaphragm, and now this is the abdominal aorta. So we've got 5 branches to keep track of in this class. 1, 2, 3, 4, 5. And just keep in mind there's many more branches off of this, but for this class, just the 5. The first of these branches is called the celiac trunk, and that's right here. Again, trunk is kind of a word that means a vessel that's going to split into a variety of vessels. And here it splits into 3 vessels. There's the left gastric, which goes to the stomach. There's the splenic, which goes to the spleen. And then there's the common hepatic, which goes to the liver. Anything with the word hepatic means something concerning the liver. The next branch down is the superior mesenteric. This is the one that is going to send blood to a majority of the small intestines and the large intestine. The next branch down is the renal arteries, right and left. They go to either kidney, and it's pretty astounding. Actually, 25% of all of the cardiac output will make its way to these organs, the kidneys, and that is kind of going to be indicated here by the size of the renal artery. When you look at the vessel going to the intestines or the vessels going to, anywhere else in the body, it's not quite as big as the renal arteries, and they are so big because they have to carry 25% of the coronary output to those, the cardiac output to those kidneys. The next branch then is the gonadal. There is a right and left. These would go to the testes in male anatomy, or they would go to the ovaries in female anatomy. Then the last branch is the inferior mesenteric. So there are 2 mesenteric arteries, superior and inferior. Once we get further down, then there will be a bifurcation. And here is where we have the common iliac arteries. Common iliac because of the fact that this is the ilium, this whole bone here. It's the ilium. Now what's kind of interesting is that there's a lot of pressure coming down off of the aorta and continually hitting against these walls. And over the course of many years, that can start to weaken the walls and actually kind of enlarge the vessel, or make a kind of a bulge, which is called an aneurysm. And it's kind of actually surprising how common this is. In many of the cadavers that I have had the privilege to see, there's actually a bulge here. I'd say probably about a third or a fourth of the cadavers I've seen, there's an aneurysm there. And I think it's partly due to this force continually being pushed against that bifurcation. Okay, the common iliac will remain the common iliac until it splits. And you'll see there's a little smaller branch here called the internal iliac that goes into kind of more of the pelvic cavity. Then the external iliac will pass through this little sheath of ligament right here, which is called the inguinal ligament, and it kind of is going to sheath the anterior portion of the pelvis. Once it passes through that inguinal canal, the hole that's in that ligament, it now is no longer the external iliac, it is now the femoral artery. And it's actually in that inguinal canal that sometimes abdominal organs can start to seep out of, and that would be a condition that we call a hernia, or it's one of the many forms of a hernia. All right, there's a nice kind of schematic in the book that helps you just remember the branches of the arteries without having to kind of see them in their complexity. So this is kind of a good thing to study from. Here we have our 3 branches coming off of the top of the aorta: the left subclavian, the left common carotid, and the brachiocephalic. Brachiocephalic splits into the right common and the right subclavian, and then the right subclavian goes to the axillary goes to the brachial goes to the radial and ulnar. And that's the same story on the left side. The right and left common, they will split into the external and the internal. And then off of the thoracic aorta, we have a lot of branches, but none of them we have to keep track of in this class. Once we get past the diaphragm and now we're into the abdominal aorta, then we have the celiac trunk, we have the superior mesenteric, we have the renal arteries, we have the gonadal arteries, and we have the inferior mesenteric. But keep in mind, this is actually found, this branch right here is actually found underneath the celiac trunk. And then we come down and off of the abdominal aorta, we have the common iliac arteries. Then from there, the common iliac, left and right, will branch into the right external and the right internal. The right external then continues on to the lower limb and becomes the femoral. If you want, you're welcome to pause the video and kind of see if you can remember the sequence of those vessels as I've just described them. And you could try it again here. All right. One thing that is not on those reviews is the what happens once we get past the femoral. So the femoral will come down. You know, here's the inguinal canal. This is going to be the femoral, 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 femoral. Once we get right behind the kneecap, it's now the popliteal or the popliteal artery. So the popliteal or popliteal would be just behind the knee here. And then that is going to split. I'll zoom in so you can see this a little bit better. The femoral is coming down here, coming down here, coming down here. And then you can see that it splits into the anterior tibial, the one that's running in front of the tibia, and then the posterior tibial. And then off of the posterior tibial, right back here, you can kind of just barely see it, there's going to be another branch that comes off, which is going to be the fibular vessel. You can kind of see this a little bit here, better here. Here's the anterior tibial, here's the posterior tibial. Off of the posterior tibial, the fibular comes off and is going to come kind of wrap around the back of the fibula. So those are some also the additional vessels that you want to know that are not listed on this review. Okay, let's take a look at the veins. The veins are a pretty similar story with a few exceptions. So again, I usually like to start with the heart. If we imagine, the heart was here, there's a little bit more symmetry here in the veins because there's, instead of a brachiocephalic trunk, there's actually just a right and a left brachiocephalic vein. They will be the brachiocephalic vein until we get to the jugular veins. And the jugular veins are kind of like the analog to the carotid vessel. The carotid, in the same way the carotid artery sends blood to the head and brain, the jugular veins drain the head and brain. But it's a little bit different here because before, in the arteries, we had a common carotid, which then bifurcated into an internal and external carotid. But here in the veins, we have no common jugular. There's just straight up the internal jugular and the external jugular. And they just don't ever come together to form a common jugular. So keep that in mind. In between them is the vertebral vein. There's also a vertebral artery, which is going to run through, in case you're interested, those little transverse foramina in the cervical vertebrae. Remember, cervical vertebrae are interesting because they have the vertebral foramen, but they also have the transverse foramen. Well, that's where the vertebral artery runs through, and that's the purpose of those foramina. Okay, once the brachiocephalic vein comes to the place where the internal and external and vertebral veins enter, now it's called the subclavian. It will be subclavian, subclavian, subclavian. And then it turns into the axillary, again, just like the arteries. Now here's a place where it's a little bit different. Off of the axillary is the cephalic, and actually I should back up. Before, in the arteries, as soon as this crossed the first rib, it was no longer the subclavian artery, but it was the axillary artery. But here, this is kind of subclavian vein until it reaches this bifurcation. And the bifurcation is the place where this new vessel to the lecture here, the cephalic vein, comes off. So the boundary is kind of here. This would be subclavian, and then once the cephalic vein comes off, then we have now the axillary. Now, cephalic is a pretty superficial vein, and it runs right in the shoulder, and you can maybe perhaps even see this on yourself when you look at yourself in the mirror. You might be able to see a little blue vessel on your shoulder. That would be the cephalic. Okay, axillary comes down, and then it's going to bifurcate. The bigger branch is going to be what's called the basilic vein, and then the smaller branch then comes into the brachial vein. And I think you can see that here. Here's the subclavian. Here's the cephalic coming off, and then here's then the axillary. Then it branches into what we would then have as the basilic, and then the smaller brachial vein in the middle. Now, what's interesting about the basilic and the cephalic is that they actually link back up with one another, which is kind of curious. I'll try and magnify this so you can see it a little better. So here's the cephalic coming down, here's the basilic coming down, and where they come together, there's kind of some linkages, and the linkages can kind of vary. Sometimes there's just a simple linkage, sometimes it happens further down, but there's kind of crisscrossing and webbing of the veins that drain, the blood from the fingers and the forearm. But in either case, the vein that's found right here, right in the antecubital fossa, is called the median cubital vein, and that's the one that they'll usually try and insert a needle into to put an IV in or to draw some blood or whatnot. Okay, moving right along. Once recall that these would be the superior vena cava. This would be the inferior vena cava, so different than the thoracic and abdominal aorta. Once we get through the diaphragm, it's a little bit of a different story than the arteries because we don't have a celiac trunk. We have a series of veins which are called hepatics. Hepatics drain blood from the liver. And there's kind of an interesting story there with the liver that we'll get to in a minute. Then we have the renal veins. And then this is kind of interesting. Before in the arteries, we had a left and a right gonadal artery that would kind of be right here off of the aorta. It's more asymmetrical in the veins. The gonadal vein comes off of the main vessel here, the vena cava, but only the right one. The left one actually comes off of this weird spot, the renal vein, the left renal vein. So I'm not exactly sure why the left gonadal vein pours into the renal vein, whereas the right gonadal vein pours back into this major trunk here. I don't know if that's significant or not, but it is a little bit of kind of quirky asymmetry that we see in the veins. Then this is all the same story down here. We have the common iliac veins, which bifurcates from the internal and external iliac veins. Once the external iliac vein gets through the inguinal canal, now it's the femoral vein. But we have a little bit of an interesting vessel here to talk about. So if we look, this is the femoral vein. There's this really long one called the great saphenous vein, and this is the longest vessel in the body. And this is the one that they'll actually go in and try and take a little piece of and usually suture it in to replace a coronary vessel, so a coronary artery or a bypass. Oftentimes this is one of the vessels that they'll use. I don't know exactly why, particularly that vessel, but you could certainly try and figure that out and let me know. Here's just some other pictures. I've already kind of talked about all this stuff, but here's a better picture of the arm, and this one actually is going to kind of show you that the deep veins are more of a dark blue, and the light blue ones are the superficial veins. So you can see this is brachial is more deep. The basilic and the cephalic are more superficial, and the median cubital superficial, so it's more visible. Okay, another view here of the uh, veins. Now, keep in mind like all of these vessels, like the deep femoral and the femoral circumflex, and all the like lateral plantar, medial plantar, and plantar venous. You don't have to keep those in mind for this class, but it is sometimes helpful to know that there are more vessels out there. Okay, here's a similar kind of schematic. Here is the right atrium, and into the right atrium, coming from the superior vena cava, so down into the right atrium, we have the left brachiocephalic, the right brachiocephalic. Both of the brachiocephalics drain blood from the arm and the head. So this is showing you, this is a little bit tricky here. On this side of the diagram, they're showing you the right and the internal and external and vertebral going into the brachiocephalic. Those would also be coming into the left side here too, but they've just removed them for simplicity's sake. And then you have, the left basilic, the left cephalic going into the axillary. Same with the brachial. We also have our left and ulnar, and we have our ulnar and radial veins. Sorry, going into the brachial. So the ulnar and radial into the brachial, and the cephalic and the basilic all go into the axillary. The axillary is going to go to the subclavian, to the brachiocephalic. Okay, and then this is the story here. We've got the hepatic veins, we've got the gonadal veins, we have the renal veins, all pouring into the inferior vena cava and making its way back to the right atrium. Also included in these is the common iliac vessels. There's the left internal, and then there's the left external. Left external is going to drain the femoral and the popliteal and the fibular and in the tibial veins. All right, now here's something that I like to talk about briefly: the hepatic portal system. This is an interesting place in the vessels, because we have what's called a portal vessel. A portal vessel, just go way back here to the beginning, is any time there's a vessel between one set of capillary beds and another set of capillary beds. You can see, oftentimes what happens is the artery sends blood to a region, it disperses through all of the capillary beds, and then a vein brings it back to the heart. But occasionally, we have blood going to a capillary bed and then going to another capillary bed and then going to the heart. So those vessels that connect them are called portal vessels. So there's this thing called the hepatic portal vein, which is draws blood from this capillary bed into this capillary bed. So if we actually look at how this appears in the vessels, it looks something like this. Blood from the superior mesenteric vein and the inferior mesenteric vein, and also the splenic vein, which is going to meet up with the and also the gastric vein and the pancreatic vein and the gastroepiploic vein. Basically, in summary, blood that's been to the large intestine and the small intestine, and blood that's been to the stomach, and blood that's been to the pancreas, and blood that's been to the spleen, and blood that's been to the stomach. All of that blood, which has been to those abdominal organs, gets filtered, or not filtered, but returned right here, and right here, and right here, and right here into this vessel, which is called the hepatic portal vessel. From there, that blood will go into the liver, where it can be, basically distributed throughout the tissues of the liver. This is good because the liver usually needs to process a lot of the nutrients that have been picked up by the digestive organs. So any of the blood that's passing in through the inferior or superior mesenteric veins is going to be blood that is rich with nutrients that have just come from your food that you've eaten, if you just had a meal. Similarly, blood that's been through the spleen might have pathogens and things in it that should be run through the liver, because the liver has a lot of defense proteins made in it that can help the immune system. fight against any pathogens from the spleen. In either case, though, all that blood goes through the liver, and then from the liver, then it drains through the hepatic veins back into the vena cava. And lastly, here's kind of the story here, where we have the femoral, the popliteal. Same story. We have anterior and posterior tibial, fibular coming off of the posterior. So very similar to the arteries. Here you can go ahead and try some review. So I've got these figures here. See if you could name all of these. If you can, you're doing really well. I've got another set of them here. If you could name all of those, you're doing really well. Okay, just a couple slides more, one of which is a discussion here about the fetal circulation. What's interesting about our circulation when we are in utero, or in our mother's wombs, is that we don't use our small and large intestine or our stomach. We're not eating anything. There's not a lot of food in a sac full of fluid, which is where we are when we're in our mother's womb. Similarly, we don't use our lungs because there's not a lot of air in a sac of fluid. So a couple of interesting things happen here. Off of the aorta, at the very base of the aorta, there are the two umbilical arteries, and they'll send oxygen poor blood to the placenta. From the placenta, it receives oxygen, and then that oxygen-rich blood, because it's going back kind of in the direction of our heart, is now called the umbilical vein. So this is another one of those stories where the vein carries oxygen-rich blood and the arteries carry oxygen-poor blood. So all of the blood that's come from the placenta that now has oxygen, it now has glucose and amino acids and other nutrients, will pass into the liver. And then from the liver, it will pass back into the vena cava. But keep in mind, when we're born, this whole placenta is torn off, and they'll cut the umbilical cord right here, and so then these vessels slowly start to decay. And what's kind of interesting is there's a ligament that's off of your liver, which is a remnant of this blood vessel that was active when you were in womb. So it's kind of a historical record of that event that stays with you for the rest of your days. Okay, there's also a similar one that attaches to the vena cava. But when they are active, that oxygen-rich blood will pool into the vena cava, and you can kind of see here it's now this purplish color, which means it's semi-oxygenated, right? Here we have oxygen-rich blood mixing with the oxygen-poor blood, and so now it's this purple color, which is kind of oxygen-medium blood. And then that goes into the heart. Remember, we have two mechanisms in fetal circulation to bypass the right side of the heart, or the pulmonary circulation. We can send that oxygen medium blood straight across to the left side of the heart through the foramen ovale. We can also, if it misses that and it continues on to the pulmonary circulation, it can jump up through this thing called the ductus arteriosus and then join the aorta. And then that's going to go give oxygen medium blood to all of the body. And then by the time it's probably made its way down here, it's oxygen poor blood again, and then it goes back to the placenta. It becomes oxygen rich. The oxygen rich blood again meets with all of the venous blood that's oxygen poor, and then it becomes oxygen medium blood again. So a little bit of an interesting story there in fetal circulation. The last thing we'll talk about is the disorders of the vessels, and the first on our list is atherosclerosis. Say that 10 times fast. And atherosclerosis is basically a narrowing of the vessels. It's usually something that's more problematic in arteries, but I imagine it can happen in veins and arteries. A normal artery looks like this, where you have a nice clear passageway for blood to flow through, and it's free and clear of obstructions. There's a nice smooth, slippery surface for blood to glide against, so it doesn't have as much friction. And what can happen is that plaques can start to form in the wall of the artery, and this is why they're concerned about cholesterol, because they think that a certain ratio of different kinds of cholesterol can lead to more of a risk of developing these plaques. Well, if the plaques do form, you can see there's this narrowing that happens here between Well, there's this enlargement of the wall between the tunica intima and the tunica media, and that's going to basically create a bottleneck here, which is going to greatly increase the resistance. And as we talked about in the previous section, if we have more resistance, there has to be a greater pressure differential to overcome that in order for there to be blood flow. And so what that basically means is the heart has to work harder, has to pump out more cardiac output to try and increase the pressure to push the fluid to flow across that high level of resistance. So it just means that the heart has to continually work harder, and it usually leads to some sort of heart disease or heart failure because the heart is tired and worn out from trying to fight against that narrowing in the vessels. One of the ways to avoid this is to maintain a healthy diet and also ensure exercise. When we exercise, the vessels open up. That will alleviate some of this increase in resistance when we have vasodilation that occurs occasionally throughout the day. Another one is varicose veins. In a normal vein, there are these valves, right, that help return venous blood back to the heart. Well, what can happen is these valves can become leaky. And so when that happens, the blood would want to return to the heart, but it can kind of be pushed back through the valve. Why this happens is a little unknown to me, so if you wanted to figure it out and let me know, I'd be much obliged. But when that backwards blood flow occurs, it can actually distend the veins because of all that increased pooling in the blood, and it leads to spiraling distension of the veins because they've got all this extra pooling of blood, and you can actually see that on the surface of the skin, these little distensions in the veins. For whatever reason, this is more common in women, and also for men and women, it's usually more common in the lower extremities because that's where the pressure of gravity is pushing down on the veins the greatest. Now, some women have told me that they'll try and spend time during the day where they put their legs up on the wall and and alleviate the pressure down in their legs, and I don't know if that helps varicose veins or not, but in either case, you're welcome to try it. All right, that completes our discussion of the vessels and the circulation.